Hi, and welcome to Practicing Clinicians Exchange podcast series on prevention of pneumococcal infection in adults, novel vaccine approaches. This is the second of two podcasts. If you didn't catch our first one, you should go back and listen to that first. This one will focus on encouraging pneumococcal vaccination. My name's Tracey Piparo. I'm a PA practicing inpatient palliative medicine at RWJ Barnabas Health in New Brunswick, New Jersey. I'm also the immediate past president of the New Jersey State Society of PAs. I'll be your moderator for today's episode, and joining me is Dr. Martin Mahoney, professor of Oncology, Department of Internal Medicine at Roswell Park Comprehensive Cancer Center in Buffalo, New York. This program is supported by an educational grant from Merck, Sharp, and Doane Corporation. This program is provided by Practicing Clinicians Exchange, is eligible for 0.25 ANCC and AAPA credits, with 0.25 credits applicable for pharmacology credit for NPs. To receive these credits, go to the post-test after you listen to this podcast, and you're going to find that at pce.is/PNEU. I'm going to remind you again at the end of the podcast, but I'll give it to you one more time. It's pce.is/PNEU. The learning objective for today's podcast is implementing strategies for vaccine uptake, including shared decision-making on pneumococcal disease vaccination in patients at risk. Hi, Dr. Mahoney. Happy to have you back. Pneumococcal is such a huge topic. So I think let's start by saying, how are we doing vaccinating appropriate patients against pneumococcal disease?
Well, it's a loaded question. I would look at it, the glass is half full and there's opportunity to fill that glass up. In other words, if we look at some national survey data from the National Health Interview Survey from calendar year 2021, that provides information that coverage rates for pneumococcal vaccination in adults over age 65 has remained steady for the last 10 or 15 years, somewhere between 65 and 70%. However, if we look at a younger adult population, ages 19 to 64, including those at increased risk for pneumococcal disease based on the presence of a whole host of chronic medical conditions, things like chronic heart, lung, kidney disease, diabetes, liver disease, cigarette smokers, those coverage rates are much lower. They're in the 25 to 30% range. So yeah, we are getting some adults vaccinated, but nowhere near the proportion that we could be achieving to provide more robust protection against pneumococcal disease, including invasive pneumococcal disease like meningitis and bacteremia. And, I think with the updated recommendations from the Advisory Committee on Immunization Practices, now we have a new opportunity to apply this more simplified set of recommendations to approach pneumococcal vaccination in all adults ages 19 and above.
Yeah, why do you think this is the case? Some people are just getting left behind or not, it's not being recommended.
Yeah, I think there are several reasons for why these at-risk adult populations are overlooked. There have been a number of updates over the last 8 or 9 years. And while the intent has always been to, clarify who's at risk and who needs pneumococcal vaccination, the end result was to make those recommendations more confusing and more difficult to implement. So that's been one issue. A second issue, I think, is a lack of appreciation among many clinicians for what the important risk factors are for this condition or disease, which is vaccine preventable and currently ranks as the second leading cause of morbidity and mortality among vaccine preventable conditions. So I think it's a combination of those factors, as well as the fact that it's not a vaccine that patients come in asking for.
Yeah, I think that's a good point. It's not one of those that the patients are coming in saying, my neighbor got one, I want one. Like the flu shot, they know that let's go get it every year. I think you brought up another good point too, as far as clinicians. I think, like, as a reminder, what are the chronic at-risk diseases that we really should be thinking of? We all think about the immunocompromised patient, but I know that really there's a lot of at-risk populations that qualify for pneumococcal vaccination.
So let me answer that in two different ways. When we think of medical conditions placing patients at risk, we can sort of imagine a triangle. And at the top of that triangle are those patients at the very highest risk of invasive pneumococcal disease. Those are the immunocompromised patients I think you were alluding to. So, patients with various medical therapies, which put them at risk, HIV populations, solid organ transplant patients, human stem cell transplant patients. Those are the individuals at the top of the pyramid. Very, very high risk of invasive pneumococcal disease. In addition, a much larger population, and we're moving down that triangle, nonetheless, who remain at risk would include individuals, and these are across the adult age continuum, so 19 years of age and above, who have one or more chronic health conditions. So again, we're talking about things like heart disease, lung disease, liver disease, kidney disease, certain behavioral risk factors like cigarette smoking, diabetes. So very commonly encountered chronic health conditions. The level of risk is really driven home when you look within an age category. So 40-year-olds or 50-year-olds, comparing individuals with one or more of those chronic health conditions to individuals without those health conditions. Those having those chronic medical conditions are somewhere between 3 and 6-fold higher risk of developing invasive pneumococcal disease. So keep in mind that notion of a pyramid of risk. And the other way to approach risk is, as we age, risk of invasive pneumococcal disease increases. So the risk of someone in their 50s is greater than someone in their 30s. Someone in their 60s or 70s is at greater risk than someone in their 50s. So I think using those two approaches, I believe, helps to emphasize and clarify to clinicians who's at greatest risk of invasive pneumococcal disease, and also why the ACIP updated these recommendations for pneumococcal vaccination in adult patients.
Yeah, I think the other thing that we touched on too is that a lot of folks just are unfamiliar with pneumococcal disease. It's not something that is talked about, unless you're, I guess, in the ID world, or if you're, a clinician that's really on top of recommending these things. And, our everyday patients are, just totally unfamiliar with it. And what do you think are some of the common reasons they come up with not getting the vaccine when it is recommended to them?
The National Foundation for Infectious Diseases recently conducted a survey among adults, at-risk adults, so folks over age 65, smokers, and patients with asthma, heart disease, kidney disease, and diabetes. And they asked them about their attitudes regarding influenza, pneumococcal disease, as well as COVID-19. So again, a fairly recent survey conducted in the time frame where we've had a lot of dialogue about vaccines and vaccine preventable conditions. But to your point, 46% of respondents say that they were unfamiliar with pneumococcal disease. 65% were unsure of their own pneumococcal vaccination status. 51% said that they have never been advised to get vaccinated, and 89% were either unsure or did not plan to get vaccinated against pneumococcal disease.
That's a scary number. That 89%, I think, is pretty scary to me as a clinician, that, they're just unsure or absolutely had no plan to do it. And I wonder what makes them unsure. Like, what are they worried about?
Yeah, so among that 89% who are uncertain or who have no plans to get pneumococcal vaccination, the top reasons that they cited were 28% reported concerns about potential side effects from the vaccine. 15% reported concerns about potential exposure to COVID-19 if they went out to get vaccinated. 14% said they don't think that pneumococcal vaccines work very well. And another 11% said that they don't think that pneumonia is a serious illness. So there's this misperception in terms of personal risk and awareness about this very important and prevalent health condition.
How do we communicate that to our patients in order to encourage vaccination? How do we have that, conversation and share in that decision making?
Well, again, I think it comes back to well-demonstrated approaches for successfully encouraging patients to be vaccinated. Number one thing is to recommend that vaccine to that at-risk unvaccinated patient at that visit. In other words, if it's not mentioned, it's not going to get done, right? Patients can't read our minds. And tied into that is really, you said have the conversation. It's a dialogue. It's part of, this shared clinical decision-making approach, helping the patient to understand why it is you're making that preventive healthcare recommendation, explaining to them why they are at risk, what the data show, touching very briefly on the strong efficacy and documented effectiveness of these vaccines, whether it's the conjugate vaccine or the polysaccharide vaccine, and the very long safety history associated with both of those vaccines. And during that conversation or that dialogue, making it interactive and encouraging, in fact, the patient to ask you questions, seeking clarification or addressing potential misperceptions that they might have, or maybe what they saw on the internet or what their friend or family member might have shared with them. That's the opportunity to educate, right? As clinicians, one of our roles is educators. And I think sometimes we get caught up in the other complexities of a medical office visit and overlook the opportunity to educate about preventive healthcare, including pneumococcal vaccination.
Yeah, I think you touched on a great thing there, saying we get caught up in everything else and kind of don't slow down and really take the time to inform the patient of, the things that we have available to them that could protect them. Prevention is, the first step in trying to fight all of these diseases. So, I know for one, when we think about a barrier as a clinician to recommending these vaccines to patients, personally, I know my parents are in that age group and they were recommended to get vaccinated, and they had to take the extra step because the office doesn't carry the vaccine. So now they had to find a pharmacy that carried it.
Another barrier, though, I hear from clinicians is, I don't have time. I have to deal with everything else in this visit. I don't have time to talk about vaccines. And the recommendation I would share with those clinicians is to make sure everybody in your office is working to the top of their license. So one strategy to do that is to develop standing orders where the nurses or perhaps other individuals, depending on what the licensing agreements are in that particular jurisdiction, would follow this set of standing orders, providing guidance on what patients would be approached about pneumococcal vaccination. And all of that conversation occurs before the clinician goes into the room with the patient. And it has the demonstrated potential to increase rates of pneumococcal vaccination. And those other clinicians, typically nurses who have the conversation, feel much more engaged on a personal level with the patients they're recommending vaccination to and administering vaccine to. And then the final strategy, again, to help prioritize the delivery of preventive healthcare is the use of daily huddles. So the whole team, everybody on the healthcare team, nurses, PAs, NPs, MDs, patient care assistants, secretaries, everybody comes together for 5 or 10 minutes and we talk about what the priorities are going to be, who we anticipate might slow the office flow down, what our strategy is to address that. And if preventive care, vaccinations, pneumococcal vaccine specifically is part of that conversation, it stays top of mind and affirms the office-based prioritization of pneumococcal vaccination, which is going to benefit patients.
Yeah, I think all of those strategies are fantastic. I love the idea of everyone in the office practicing to the top of their license. And, sometimes I agree with you. They hear from the nurse and the nurse answers some questions and they may bring it up in the office when they're sitting there with the provider, but it's now they have more power behind them because this isn't a new concept to them. It's already, been mentioned. So they have a lot more confidence speaking to the provider about it. And now you're simply just reinforcing something they've already been told. So, most of the time their mind is made up that they're going to do it at that point. And I feel like it gives us a much better footing. Do you think with the new recommendations that there's going to be any issues with providers kind of implementing these strategies, or you think the ACIP recommendations are going to make it a little bit easier now?
I'm very excited about the updated pneumococcal recommendations based on the fact that they represent such a dramatic simplification of how to approach pneumococcal vaccination in adult patients. Now, I want to also mention that there is a mobile app called PneumoRecs, PNEUMORECS, Vax Advisor, VAXADVISOR. And that can be downloaded, and you input the characteristics, the age and medical conditions, chronic medical conditions for your patient. And that would represent kind of a on-the-fly strategy to simplify implementation. Because with the new recommendations, it's a matter of educating clinicians through conversations such as this, making them aware of the pending update, and providing the resources on where to go and how to implement this on a day-to-day basis in their clinical practice.
I think that's great. I think that we talked about a lot of good information and ways to encourage vaccination among our patients and some strategies for providers to help get them there. So I want to thank everybody for listening today. I hope you enjoyed this podcast as much as we enjoyed providing it for you. And again, we talked about strategies to encourage pneumococcal vaccination and improve our pneumococcal vaccination rates. Remember, we all want to get credit for listening to this and doing our hard work. So you're going to visit pce.is/PNEU. You're going to take the post test and claim your credits for the activity. One more time, that site is pce.is/PNEU. Thank you again, Dr. Mahoney.
Thank you. It was a pleasure to have this conversation today, Tracey.